In the sarcoma category, it's pretty rare. In fact, in my 10 years of practice, I've not seen one personally. I've only seen this in teaching files and in the literature. It's estimated that less than 1% of Past disease patients would have sarcomatous degeneration. However, when they do get a sarcoma, the prognosis is extremely poor, even compared to the typical sarcoma patient. And the reason is these sarcomas are extremely high grade, very anaplastic. And it can be any number of sarcomas. It can be osteosarcoma, fibrosarcoma, chondrosarcoma, you name it, they can happen. And clinically, any patient with new focal pain and new area swelling will be worried that there's a sarcoma occurring. And the X-ray features of these patients of Past disease with the sarcoma is kind of different. They're very aggressively lytic, lots of cortical destruction. They have soft tissue mass, and most importantly, there is usually no periosteal reaction. Why is that? We just said a minute ago, these are very high-grade anaplastic tumor. They're so high-grade, so fast-growing that the body cannot even lay down bone, cannot lay down reparative bone, and that's why we don't have periosteal reaction. In addition, the osteosarcomas we generally see, obviously we can tell because of the new osteoid bone formation. Well, in Past disease, they're so high grade that there's not even new bone formation. So the osteosarcomas in Past disease don't usually have an osteoid matrix underlying. So on MRI, we talked extensively of this, looking carefully on the T1 weighted sequence for the yellow marrow. When you lose that yellow marrow on the T1 weighted sequence, we have to be concerned. Is there a mass that's now displacing the normal yellow marrow cells too? So in this patient, this is the tibia, very much bold, thickened cortex. Trabecular pattern is coarsened. So this patient is Past disease. He has new pain over here in the anterior part of the tibia. And you can see this area of cortical destruction with some elevation of the periosteum and a palpable soft tissue mass. On MRI, I apologize, this is one from the literature because I've not seen one in person. So the quality of this MR is not very good. But you can see on this T1 weighted sequence, there is this confluent area of low T1 signal that has displaced the normal yellow marrow fat. This is very concerning when you see that. So the patient had the tibia resected. This is the tibia here. This is the femur. And this is that area of abnormal medullary space, that mass we saw on the MRI, this white tumor that has destroyed the bony cortex, the soft tissue component. Another example here of the humerus. The patient has cortical thickening, has disease, and there is new osteoid-looking bone here in the mid-diaphysis. So this patient has an MRI, T1 weighted sequence, very dark. The normal bright yellow marrow has been displaced by this dark confluent low T1 process. It has an adjacent soft tissue mass. On the pathology, this is the tumor here, tumor growing. This was an osteosarcoma. So unlike what I told you earlier, this patient did have osteoid matrix in his osteosarcoma.